Dr. Beck, let me ask you, what are the symptoms or illnesses which a person could have experiencing where there's definitely a red flag and maybe has been trying to treat them in any shape and form, but the illness obviously didn't go away or the symptom didn't go away? What are some of those illnesses and symptoms where a nerve test is indicated?
It's a great question. A lot of people, again, try to interpret their own symptoms. In other words, they try to figure out what's going on without the nerve test. And that can be really difficult because without nerve testing, a lot of times you can't tell if it's a pinched nerve in your neck, pinched nerve in your wrist, diabetic neuropathy. There's a lot of different conditions that can result in problems that need nerve testing. So what kind of symptoms do people get? Well, the thing I tell people to look out for, anytime you have numbness in your hands or feet, that's something that needs nerve testing. If you have weakness in your hands or feet, that's something that needs nerve testing. Now, the other type of symptoms that people frequently get that can be evaluated with nerve testing is shooting pains. For example, if you cough or sneeze or tilt your head back and you get shooting pain down your arms or legs, it's very likely that you have a pinched nerve in your neck. Likewise, if you lean over or cough or sneeze and get shooting pains down your legs, you can also have a pinched nerve in your back, much like your neck. And these are all conditions that can be evaluated with carpal tunnel syndrome, be evaluated with nerve testing. And a common condition that we frequently see with nerve testing is carpal tunnel syndrome. So the symptoms, numbness, weakness, burning pains, shooting pains are all symptoms that could indicate some type of nerve damage, such as a pinched nerve in your neck, carpal tunnel syndrome, a pinched nerve in your elbow, or diabetic neuropathy, and all these can be successfully tested with nerve testing that we do here at the Valley Center for Nerve Studies and Rehabilitation.
All right. Now let me ask you, what about the cramp? Your legs cramp up at night when you sleep, maybe? Is that something also?
Possibly. Now, if you have nerve damage or nerve being pinched, such as a pinched nerve in your back, sometimes you'll get terrible cramping pains in your legs. Now, the type of testing I do can't help identify restless leg syndrome, and a lot of people ask me that question. So if it is restless legs that you have, we won't be able to tell that on our machine. But if you have another problem that's acting like restless leg syndrome, such as a pinched nerve in your back, then we can certainly look for it with our nerve testing.
All right. Now, are the symptoms which you described, the numbness, the tingling, the shooting pain, is there any type of the day, where there are more? I heard that it's very common when you sleep that certain things happen, and most of us, hey, gee, maybe I need a nerve testing because every so often at night, obviously my hands do fall asleep.
Mm-hmm. Yeah, there's 2 or 3 conditions that frequently get worse at night, and people, again, they frequently come in and talk to me and say, wow, my hands go to sleep at night or my feet hurt at night. Carpal tunnel that we mentioned frequently gets worse at night, so people wake up shaking their hands and they have numbness in the first 3 digits. That's the thumb, index, and ring or middle finger. Now, another condition that occurs at night is where you get the ulnar nerve compressed at your elbow. Now, that's where your funny bone is. It's that little rubbery thing right under your elbow there. And if you sleep on your back at night, frequently you'll put pressure on that nerve. Now, in this case, what will happen is your 4th and 5th digits will go, that's your ring and little finger. And so, again, people wake up with a numb hand, but it's going to be different fingers. The other condition that frequently gets worse at night is a diabetic neuropathy. And people often tell me that, gosh, when I lay down and go to bed at night, my feet start to kill me. The sheets hurt my feet burn, and I just don't understand why they get worse at night. And I don't really know why either, but that's really common with diabetic neuropathy, that people will note that their pain gets a whole lot worse. So you can have pain in your feet that gets worse at night from a neuropathy. You can have pain from a nerve being pinched in your elbow, and also from carpal tunnel syndrome. All these can get worse at night.
Wow. And very obviously, there's lots of information out there that not sleeping causes a host of problems. And if a person gets interrupted in his sleep over and over again, in fact, I do have a friend who happens to be, in fact, in the medical field, in the dental field, and he has that problem. And he says it's really getting to him simply because, well, you you wake up, you're more aggravated, you're more tired and exhausted, and yet throughout the day you have to be, in order to survive and in order to have fun and live life, you have to be at your best. So is that true? Do you see that with your patients?
Oh, yeah. Lack of sleep can cause a number of problems. One problem is people don't realize it can make you gain weight. Another problem, yeah, it's hard to lose weight when you don't get good sleep. The other problem is you can become depressed, irritable, start to have problems with your thinking and concentration. And if you lose enough sleep, you can actually become psychotic. So losing sleep is a big deal.
So very obviously, never mind the pain, but the interruption of sleep, it just, you want to get checked.
Oh, yeah, absolutely.
Well, good. Well, thanks for the information, and I will speak to you soon.
Okay, thank you.